Hi there, this is Dr. Chula Vitana. I wish to speak to you about Sri Lanka medical tourism, specifically addressing our company MEDILANKA Wellness PVT Limited. Medical tourism is one of the fastest emerging tourism sectors in the world, and Sri Lanka has great potential for tapping into its massive global market size. As we all know, medical tourism is one of the emerging tourism sectors in the world. In every year, 14 to 15 million of people are traveling abroad, expressively for medical treatment from dentistry to transplant to cancer and cosmetic surgery, spending a combined of $3,800 to $6,000 per visit on medical care, transportation and accommodation. It is estimated that this market is growing in 10 to 15% per year. Of this, 111 billion was especially coming from the Asian Pacific region. Therefore, we have great potential to tap into this market. First, let's understand the Sri Lankan market. Sri Lanka is known for its rich cultural heritage, breathtaking landscape, and warm hospitality. The country boasts a growing healthcare sector of internationally trained medical professionals of highest caliber. They are trained in modern healthcare facilities with most up-to-date medical technology to provide best care to wellness tourists. Sri Lanka is already making strides to establish itself as a prominent destination for medical tourism. The country healthcare sector has been attracting increasing number of tourists from abroad. Government has identified health tourism subsector that could help lift export earning to 20 billion target it has set for about 20 to 24, maybe 2025, building only by the tourism and health. Our company MEDILANKA Wellness PVT Limited is to make that an absolute reality. As Dr. Hemantha Athukurale proclaimed, Sri Lanka has the skilled medical workforce to start medical tourism in big times. As he says, Sri Lanka has the skilled medical workforce to start the medical tourism. And he also say that we have the tourism attraction to capture the heart of all medical tourists. In a country which is struggling with just raw material and labor export, medical tourism utilizing professional expertise might be the way to forward. The need of the hour is a group of individuals willing to steer this concept to an ultimate success. It is with his remark which gave us the tremendous power to embark on this journey, and we believe our company can make Dr. Athukurale's wishes come true. Here is the website which his article was published on Daily Mirror. The Professor Rangana has embarked on a study on the potential of developing medical tourism in Sri Lanka with special reference to major private hospitals in Sri Lanka. Professor Rangana is the Professor of Department of Tourist Management at Sabaragamuwa University of Sri Lanka. He has conducted this research on medical tourism as a valuable niche market. These are the websites that we can visit, and he has published 2 articles on the same subject. Most importantly, another article which is a combined process of using indigenous medicine combined study combining with wellness program as potential developing medical tourism in Sri Lanka. The authors are the Arachi RSSW at Sabaragamuwa University as well as Nanayakar and Singhe, who are from the University of Indigenous Medicine. This is the article. They both proclaim that combining indigenous medicine is the way to go to potentiate the medical tourism, as concluded specifically by Professor Rangana in the previous slide. In order to promote medical tourism, our country planned to create a new medical faculty. And government has implemented these new strategies for developing the human resources and promoting activities to develop medical tourism in Sri Lanka. Rangana Sri Shashika Vadipulle Arachi is the professor at the Department of Tourism Management, Sabaragama University of Sri Lanka, who would be facilitating this and creating a new medical faculty. Problems have been discovered and solutions were offered by this research work. As per Professor Rangana, who has indicated developing awareness and providing special training for both doctors and nurses and other employees and human resources factor is the must do in order to develop the medical tourism segment. Therefore, he is offering some strategies which can be applied, specifically arranging overseas training program for higher-end surgeries and increasing in-house doctors and nurses, which are of most important according to his assessment, as well as facilitating abroad work expense for nurses. Establishing nursing school with a higher standard would help the development of human resource factor, as he has correctly pointed out. This is the research work finding the factors affecting the developing medical tourism in Sri Lanka. According to his research, selection of the appropriate hospital, reducing the cost, waiting time, as well as reputation of the hospital, accreditation of the facility, availability of the support, and the human resources wise, he claimed number of doctors available in the accredited hospital, number of nurses, service qualities, and language fluency. He also emphasized on accommodation, on the availability of transport, facilities in the hotel rooms, available attraction, and promotions via internet and promotion of the doctors. He emphasized very importantly. He also emphasized the government support on the private sector and the government support on the policies and rules, and the dependent variability of arrival, number of arrival also can be a determinant factor in his assessment. In the summary of correlation of the independent variables of this study, hospital selection, human resources, accommodation, facility, promotion, and government supports are the ones that he is emphasizing most. The higher value of P value above 5 is considered a significant value, including the human resources. Others are lower than 5, therefore is sufficient according to his assessment. I would now like to discuss about our company MEDILANKA Wellness PVT Limited multifaceted plan to tap into the tremendous potential for Sri Lanka medical wellness program. Our wellness medical company is committed to the vision of collaborating with the Sri Lankan medical professionals as well as US medical professionals to transform current medical tourism care in Sri Lanka. Our goal is to become global medical tourism company effectively, while also incorporating our country's unique holistic wellness program as proposed by Professor Rangana in his recent study. The most importantly, uniqueness of Sri Lankan holistic medicine, known as Hela Vedakama, which is a component of Ayurveda which cannot be found anywhere else. That is what we should be promoting in our MEDILANKA wellness program. To be a high value but extremely affordable destination offering an extraordinary price on the wellness tourism experience, we would like to offer to reflect the Sri Lanka's natural and cultural heritage. Our company priorities are in identifying the basic need of medical tourism as a more critically important component. We claim we must ensure that we provide a special care to the international patient, because if they will have a memorable experience, they will definitely return as well as refer more patients to our company. That means that benefit the country. International patients have their own set of expectation from healthcare facility, which involve international patients may be traveling far away from home to obtain these medical services. They might be on a limited budget, and they may not understand our language, and the culture may not be informed about the medical process properly. Therefore, our company prioritized this important identification. Let me now clearly explain the typology of MEDILANKA Wellness PVT Limited health tourism. We broadly divide the health tourism into wellness tourism as well as medical tourism as two separate subjects. Wellness program or the wellness tourism are offered only for healthy individuals who would like to jumpstart after stressful environment during their vacation, mainly seeking mental and physical well-being for them. This is where we believe we can dominate on Sri Lanka Ayurvedic treatment facility to jumpstart their mental faculties, improving their mind, can also sometimes give them a screening program to check their health, and providing that totally different from the medical tourism where a patient already has a diagnosis of medical condition which requires surgery or medical attention. Medical tourism is broadly divided into non-cosmetic surgery or elective surgery and to cosmetic surgery, which include dental services. We believe that the wellness program, approaching in a comprehensive manner like what we have planned, will be the ideal way to address wellness tourism. The major component of offering the ultra-low cost affordability of surgery and the medical wellness through our MEDILANKA Wellness PVT Limited, we consider is the greatest competing asset that we have over other countries. One of the main advantages of Sri Lanka medical tourists seeking treatment abroad is the most cost saving they can achieve. We believe we can afford to give much more competitive price through our MEDILANKA Wellness PVT Limited, so that we can get these patients to come to our country much more effectively. Offering the ultra low cost affordability while emphasizing the competitiveness in our pricing and value for money when compared to India and other countries, we will be offering much cheaper prices compared to other destinations. We consider affordability factor of MEDILANKA Wellness PVT LTD is the greatest competing asset that we have to attract the patients. We plan to provide maximum accessibility and the tourism convenience to our tourists. To tap into wellness tourism market, our company must ensure seamless accessibility and convenience. This includes facilitating visa processes, providing transportation arrangement, and offering comprehensive health care packages. Our administration staff who work with international patients are willing to go for extra mileage in helping our patients. We work only with the major private hospitals who are well experienced, who provide the maximum convenience to our tourists. Our major private hospital and the key institute which we are using for medical tourism in Sri Lanka are all geared to help our patients. We always leverage toward the hospitals that are accredited by Joint Commission of International Standard. It is of utmost importance for our patients. We are leveraging towards the hospital who are partnering with that accredited by the Joint Commission. Since the JCI accreditation, which is certified that the hospital meet the same rigorous standard as in the US, is among the top growth drivers of the medical tourism in emerging market, and most importantly, our patient will benefit maximally. One key benefit by Joint Commission International is the gap analysis, which help the hospital to identify and improve their standard to better cater to the needs of expectation of our international patients. We are providing maximal cultural consideration to maximize the patient experience. Our first armamentarium where we going to initiate this program is the Middle Eastern countries, and we would like the Middle Eastern patient to be placed in a significant importance on cultural and religious traditions. Accommodating their cultural need and ensuring a positive patient experience is vital for healthcare providers like us aiming to attract this market. Below are some key strategies we have considered and guaranteed to provide. We understand the importance of the mother tongue in communication with these medical tourists. Medical tourism always requires communication in the tourist's mother tongue. This applied during the medical trip to the inquire about their health condition and recommendation, treatment planning, and it also they would like to inquire about the cost of the treatment, inquire about the quality of the treatment and the quality of the hospital facilities, while providing personalized service and clear communication are the necessity for medical tourists. Constant communication with the physician and having interpreter who speak the mother tongue of the tourist is always required for most wellness tourists who insist on personalized services. Communication in their own tongue is of most important, and we value that to the maximum. Halal food and the religious facilities for prayer, especially for Middle Eastern patients that we are first going to bring in from Oman as well as other Middle Eastern countries. We will be respecting religious belief, which is extremely crucial. We will be providing halal food option if they so decide. We will be ensuring access to prayer rooms or religious facilities within the healthcare facility. We take extraordinary care and enhance the patient experience during their stay while respecting their religious needs. Our goal is to make Middle Eastern patients feel more comfortable and valued and happy customers. All our hospitals that we have contracted with render personalized care and warm hospitality. Our Sri Lankan culture emphasizes the warmth and hospitality. And it is in our blood. We have that high reputation of hospitality. Since our social orientation of our culture hinges on a traditions of care and empathy, Sri Lankans are often credited for their warmth and friendly nature, which is shown towards our travelers and the tourists without difference. Our healthcare providers, including doctors and nurses, strive hard to create friendly and welcoming environment and atmosphere, providing personalized care. We cater to the unique needs and the preference of wellness patients and their families. Our company doctors will visit patients in addition to the hospital staff doctors to provide extra layer of personalized care. These are the references that we have put into in our description and explanation, especially the Atikorale article, Daily Mirror articles, and Sri Lanka Tourism Board annual statistics, and many other research work pertaining to the wellness program. I thank you for listening.